NCCN, the National Comprehensive Cancer Network, is an alliance of 28 leading academic cancer centers across the United States. We develop clinical practice guidelines in oncology that cover 97% of cancers and the entire continuum of cancer care. So as part of our guidelines, we've now incorporated the NCCN evidence blocks in oncology, which contain 5 different domains to assess value. So they're intended to be a tool for patients and clinicians to use in a shared decision-making process based upon their individual values for treatment. The patient voice is critically important to defining and assessing value in oncology. So NCCN has several avenues through which patients and patient advocates can engage with this process. The first is a continuous and transparent public submission process for requested changes to the NCCN guidelines. This is publicly available online. It's open continuously, so 24 hours a day, 7 days a week, 365 days a year, anyone can go to our website and look at the process through which they can submit a requested change. There are regularly scheduled panel guideline meetings, and so we do request, if possible, that people submit requested changes 4 weeks prior to those scheduled meetings, which can be found online. However, it's not required. People can submit at any time. So that's one avenue through which people can engage. Another is that NCCN has patient and patient advocate representation on our guideline panels so that the patient voice is there at the decision-making table as well. We also use a guideline user survey. So when people use our guidelines, we have a survey that people can complete to provide feedback continuously. And that feedback is considered by NCCN. And then lastly, NCCN strives to engage with patients and patient advocates throughout the year through a variety of events. One of those, which is coming up, is our Patient Advocacy Summit. We have this annually in December, and it's a place to convene a variety of stakeholders, but primarily patient advocates, to discuss pressing issues in oncology and in health policy. This year's summit is actually focusing on value and patient definitions of value. So that's another area where anyone can come and engage with us and help us to better understand the patient perspective. NCCN has been engaged in value assessment initially with our evidence blocks, which began, I believe, around 5 to 7 years ago. So we've been doing this for a few years now. So I'm going to speak specifically to our public submission request process. So as patients and patient advocates are preparing to submit a request, I would really encourage them to think about the evidence and the data that they are submitting for that guideline panel to consider. All changes that are made are based on evidence and expert consensus. So considering why the evidence supports this becoming the new standard of care in oncology is important. Why does this warrant a change in standard practice? And how will it ultimately impact patients' lives and care outcomes? Those are the kinds of things that should be submitted for consideration.